think the biggest thing is that there are a million different ways to be a pediatric psychologist. Yes, there are a million different ways to be a pediatric psychologist. There's not one way. And so just because it doesn't exist or because someone isn't doing it doesn't mean you can't do it too. So that is probably the biggest learning, is that sometimes when you go into fields or areas of study that people don't look like you or don't have the same ideas, you might start to question yourself or wonder if, is this for me? Is my voice important here in this space when that's not what everyone else is talking about? And I will say, yes, it is. We need you. We need your talents. We need you to come have brave conversations. We need you to bring your unique ideas that don't already exist in our field. We need you to bring those ideas to make our field of pediatric psychology reflect the beautiful diversity that exists in these United States. And so, even though you may not see someone doing exactly what you want to do, know that your type of pediatric psychology is needed, is important. We would love our fields to reflect the diversity of our country. And so we need you. So I hope you consider bringing your voice, your talents, your abilities, your ideas. No idea is too unusual, out of the box. What we're trying to do is help kids and families think about their health and mental health. And if you have an idea for how to do that, then please come and bring your talents to our field. Your leadership, your voice matters, is important, and is needed. I think pediatric psychologists can address racism in their work in lots of different ways. As a pediatric psychologist, one way that I think is really important is in the clinical room. So when you're meeting with families, trying to understand their experiences with racism, understand how those experiences affect how they're showing up in that medical provider office or outpatient office. Also in our research, so as a pediatric psychologist, I address racism in my research by including measurements of discrimination and racism, in developing interventions to help young people cope with racism, to remember their superpowers and how they have learned a lot of things because of that adversity of racism, that they've developed resilience and strengths and positive things, even in the midst of that adversity. And so really trying to center positive things, not just negative things, because racism is hard. And because we've gone through that hard experience, there are many positive things that have happened. So I think as pediatric psychologists, we can center both of those things by thinking of the whole person and asking those hard questions that many people don't want to be asked, really having culture brave conversations, right? Difficult topics that people don't want to talk about, doing that and doing it in a way that doesn't promote blame or shame.
For me, in relation to addressing racism in my work, a part of my work has been about understanding the impact of racism, particularly racial discriminatory experiences experienced by kids with sickle cell disease and Black children who experience pain, and how that impacts their lives. And so for me, I study it so that people can really understand that racism doesn't just have an immediate impact, it has a long-term impact. Some of the work that we have been doing has seen how racism and racial or discriminatory experiences, particularly for Black youth, tend to lead to a number of sleep problems. And not just for them, but also for their families, impacting the sleep and the exhaustion that their families feel, which then sometimes subsequently can lead them to have less resources to work in their day and to feel more anxious or more depressed or to be more vulnerable to pain experiences. And so for me, a large part of how I address or how I deal with racism in relation to the work that I do is to try to understand it, but then to also try to translate that for other people so they can see the impact that racism has on the health of children and their families, so that they will be motivated to make those changes to actually address those issues. Another part of how my work addresses kind of racism in pediatric psychology is educating healthcare providers so that they can actually see their own bias. So they can see what they're doing that might be offensive, that might be discriminatory. So they can start to standardize their practices. So a lot of that is, the teaching that I do, future healthcare providers, as well as some of the educational programs that I've helped to run when I partnered with community groups for healthcare providers who are actually out there in the field, working in emergency departments, working in primary care offices, so that they can have this understanding of this is what you think you're seeing and this is what you think you're doing. But what you're actually doing is making it harder for this person to seek care. And you're actually, what can you do? And so a large part of it is kind of teaching them both to recognize their bias and also think about what can I do to reduce bias and make this feel like a space where all children and their families are going to feel comfortable and are going to be willing to work with me. And how do I make it so this is the best experience for them that's going to have an impact? Truthfully, every healthcare provider wants to have an impact, but understanding what it takes to get there and that racism is going to stop that, I think that's sometimes eye-opening, and it's also something I know we can push past.
One of the ways that pediatric psychologists can address racism in our work is recognizing that racism is one of the major drivers of health disparities. And health disparities are essentially when groups of people who have different social characteristics have different health outcomes. So essentially those who are disadvantaged or underrepresented or vulnerable have poorer health outcomes, so are sicker or live less long or just don't have as much health as other groups who are considered in the majority or who have more privilege. And so in recognizing that racism is a huge part of creating and maintaining these health disparities, one of the things that pediatric psychologists can do is speak about it in all the different ways that we see it pop up, both in clinical practice, in research, when we teach, as well as advocacy. So speaking to legislators and insurance companies and other professionals about where this pops up and why it's problematic and things that can be done to improve.